Although rare, tumors can appear in children, with some cancers having aggressive growth. We spoke with Dr. Maryam Gholizadeh from Children's Hospital of Orange County to find out about the treatments that are saving these young lives.
Tumors that I deal with, most common in kids, neuroblastomas, liver tumors, hepatoblastomas, tumors of the kidney, Wilms tumor. There's some tumors arising in the chest cavity, tumors of soft tissue, extremities rising from the muscle or any other areas in the soft tissue. But at CHOC, we deal with a broad range of, because of areas of specialties that we have, we pretty much can deal with most of the tumors from the brain all the way down to the lower extremities. There's certain tumors that are more common than others, that we do see them during our training, but there are more complex tumors that are not very common. I mean, these are kids, so these are very young age, starting from neonates. The time of birth, some of these kids are born with these tumors. So as you can see, they're not very common. It's not like you go through in your lifespan and then develop so you see more. These are very rare tumors, especially in some of the pediatrics at a younger age.
We asked Dr. Gholizadeh, are these cancers hereditary?
These are multifactorials. You have genetic, you have hereditary, genetic. There are some areas like mutations can cause that. There are some theories about exposure of both mom or dad during pregnancy can cause. These are all areas that are still questionable, but they all have an effect in developing cancer, especially in kids. And that's what the area that's the research is still going on.
What are some of the procedures used for these tumors?
If there are benign tumors in the chest, we can use thoracoscopic approach. Tumors that we need to get diagnosis, biopsy, what we do is through these little small incisions, we get the diagnosis, so we'll be able to approach them. So these are really the good indications for taking tumors out, because you always worry about the larger tumors that you can break the tumor. You will not be able to do this with minimal invasive techniques unless they're benign, or you can be sure that you can take them out safely for these kids. But again, these are some of the indications we use. Minimal invasive, some of us can do robotic surgeries that my partners, to approach these tumors. Kids can be very tricky, especially younger age, because they don't talk, they can't communicate. So, and parents are very, very good. One thing I learned in my training, and one of my mentors told me, he says, if you don't learn anything, just learn one thing. Listen to parents, particularly moms. They're very close to their kids, and they can tell you when they say something is not right, you can be sure there's something wrong. And that's very important. If they see something is not right, they should be persistent, and if they're not happy with the answers they're getting, they should see second or third opinion to find out what's going on with their children. Because as I said, if they spend most of the time with their kids, so they know how their kids are. Young age might be just the symptoms could be fussiness, not eating very well, kind of lethargic, not playing well, tired. But these are all the symptoms that might be, oh, it's just nothing. But for the parents who know their kids, it can be big or just a warning sign that something is going on.
Dr. Gholizadeh describes the successes in these procedures.
It's very gratifying. Kids come in because kids, when they are sick, they're truly sick. There's no fakeness in their illness. This is something that happened to them without them voluntarily doing anything harmful to themselves. So they come in, they're very ill. When you take care of them, there's a rapid recovery. Kids can tolerate big stress, but they bounce back very fast, and they do great. And when you see them afterwards, even though the disease might be very advanced, even if you get 4, 5, 6, or about a year out to expand their life, it's just very gratifying to see them back with their parents and how quickly they recover. And that's exactly why I decided to do this, because what you see them when they're sick, and when you see them when the tumor's out and they're out the door, it's just phenomenal.